We're going to look at the heart, and we're going to first of all go over the external features of the heart. There's a number of large vessels that go into and out of the heart. This is the heart's right side and the heart's left as it sits in the body. And there are three large vessels that can be seen from the front. The vessel furthest over on the heart's right is the superior vena cava. That's bringing blood back from the head into the right side of the heart. Inferior, in the back of the heart, is where the inferior vena cava enters the right side of the heart. Both of those vessels go directly into this right atrium, which is the top chamber on the right side of the heart. In the center, there's a large red aorta. The aorta is the vessel that's carrying blood from the lower left ventricle out to the rest of the body. At the top of the aorta, there are three branches that leave the aorta and go up. This first branch is the brachiocephalic artery. That's going to come across and branch further into a subclavian and a carotid artery. The next branch is the left common carotid. And the third branch is the left subclavian. The large blue vessel that's coming up just to the left of that is coming out of the right ventricle. This is the pulmonary trunk. The pulmonary trunk is an artery that's carrying blood to the lungs. In the back of the heart, that pulmonary trunk splits off into two pulmonary arteries that go to the right and left lung. Also in the back of the heart, you can see four red pulmonary veins entering the left atrium. These pulmonary veins are returning blood from the lungs into the left side of the heart. The heart has four chambers, two atria and two ventricles. The right atrium and the left atrium separate in the back, right where the pulmonary veins enter the left side. So this entire structure is right atrium, and from here around to the front is left atrium. The ventricles separate right where these large vessels go down in the front and in the back. This side is the right ventricle. And this side is the left ventricle. Blood flows through the heart, going through the right side to bring blood from the body out to the lungs, and then gets returned to the left side, bringing blood into the left atrium and then through the ventricle out through the aorta. On the outside of the heart, you can see a depression separating the right and left ventricles with all these vessels. The depression, not the vessels, is called the anterior interventricular sulcus. There's a similar depression on the back that separates the ventricles, also with some large vessels in it. This is the posterior interventricular sulcus. At the bottom of the heart, it comes to a small point. That's the apex of the heart. When we go into the heart, you can see the insides of the chambers and the valves. Again, the right side and the left side. On the right side of the heart, separating the atrium for the ventricles, is a small valve called the tricuspid valve. This valve is attached to the lower end of the ventricles by these stringy chordae tendineae. The chordae tendineae anchor to large muscles in the bottom of the ventricle called papillary muscles. This also is another papillary muscle. In the left atrium, the right atrium, you see a small red spot just above the tricuspid valve. This is the coronary sinus's entrance. The coronary sinus is a vein that brings blood from the heart muscle itself back into the heart for recirculation. There's also a fingertip-sized depression just above and behind the coronary sinus entrance. This is the fossa ovalis. The fossa ovalis is the remnant of a fetal structure called the foramen ovale, where blood was shunted from the right side directly to the left of the heart. So the fossa ovalis. There's a wall that separates the two ventricles. This is the interventricular septum. At the very top of the interventricular septum, you see another valve going into the pulmonary trunk. This is the pulmonary semilunar valve. On the other side of the interventricular septum, just behind the pulmonary trunk, is a similar semilunar valve. This one leads into the aorta. So this is the aortic semilunar valve on the left side. Directly next to that, there's a similar valve to the tricuspid valve. This is called the bicuspid or mitral valve on the left side. Also with chordae tendineae attached to large papillary muscles. You can see layers to the heart. The inner lining of the heart is a connective tissue layer called the endocardium. You can see just along this section, this pink edge. All the darker red represents the heart muscle, and this is myocardium. Not really shown well, but covering the entire outside of the heart is a fibrous connective tissue membrane called the pericardium. Epicardium. This is the same thing as the visceral pericardium, so the terms can be used interchangeably, visceral pericardium or epicardium. Inside the chambers of the heart, the muscle is ridgy. Up in the atria, the ridges are called pectinate muscle. In the ventricles, the ridges are called trabeculae carneae.